Hi there, my name's Brooklyn and I'm going to be presenting today on Binswanger disease, which is a subtype of dementia, also known as subcortical dementia. So I'm going to be having a few visuals that I'll be holding up as I describe throughout this presentation what Binswanger disease is. Binswanger disease is a progressive neurological disorder. When I say it's progressive, I mean that over time it worsens. It is caused by arteriosclerosis and thromboembolism. You'll have to excuse me for that awful pronunciation. But this affects the blood vessels that supply the white matter and deep structures of the brain. So, when I first read this definition, I was like, I don't know what that means. So to break it down, arteriosclerosis is the blockage of blood flow due to artery disturbances. And I drew a picture so you can imagine the blood flow is going, and then there is a blockage. It's hard to do right there. Thromboembolism is obstruction of a blood vessel, also known as veins. So basically, arteriosclerosis and thromboembolism both mean obstruction of blood flow, either because of an artery or a vessel. And a reminder to myself and my viewers, arteries carry blood away from the heart, while veins carry blood back to the heart. And the deep structures that this definition is applying to would be the thalamus and the basal ganglia. So let's get into what does subcortical vascular mean? Well, subcortical means below the cortex, which if you can see here, I drew a little brain. Here's our cortex on the outside, and then subcortical would be everything on the inside of the brain. It comes from the root word, the Latin word bark, so you can think of it, if you're imagining the brain as a tree, you can imagine the bark as the cortex, and then everything inside the tree as subcortical. And vascular means your body's network of blood vessels. So, subcortical vascular is a fancy way of saying blood supply to the brain. Okay. So I found this from an article and I found it really helpful, so I'm going to read it and then break it down. Histologic, metabolic, and neurochemical investigators, so anybody that studies the brain basically, implicate dysfunction primarily of subcortical neurotransmitter systems and subcortical structures or subcortical frontal connections in the genesis of the syndrome. So, going over the terminology, we have neurotransmitters, which are the chemical messengers. So I did a little illustration here where the brain is saying over here and the mailman is looking the wrong direction, implying that if these were our neurotransmitters, there is some type of disconnect here where the message is not being delivered properly. The subcortical structures that are involved, again, are the diencephalon, the pituitary gland, the limbic structures, and the basal ganglia. All right. Going into the basal ganglia, this is the most important part of the entire, part of our brain is what is most affected because of subcortical vascular dementia. So the basal ganglia, according to Lansigo and Luquin in 2012, refers to a group of subcortical nuclei responsible primarily for motor control and learning, executive functioning, and behavior/emotion regulation. So subcortical nuclei is literally what the basal ganglia is. So the associated structures would be the striatum, also known as the cauda putamen, and globus pallidus. Again, I drew another little brain guy for us. If we look closely, the X's are the basal ganglia, while the blue is the related structures, which would be the amygdala and the thalamus. Okay, so that kind of describes what the basal ganglia is, and so now we can better understand that if the basal ganglia is being affected and not getting enough blood flow due to this disease, then obviously it can be inferred that the person going through this would have difficulty with executive functioning and behavioral regulation. Here is a more pretty picture of it that I thought I would print out since I'm not the greatest artist. And here we have another view of it. As you can see, the ventricles here. The ventricles here are what allows the blood flow to come and bring blood to supply blood for the basal ganglia. Okay, so moving on, we're going to talk about the symptoms and causes of subcortical vascular dementia, also known as Binswanger. So it can be caused by CADASIL, which is a very, very shortened abbreviation for the name of cerebral autosomal dominant arteriopathy with subcortical infarcts. So that's a really long name for a rare hereditary disease. Binswanger disease is caused by arteriosclerosis and thromboembolism, which we talked about earlier, and other diseases that obstruct blood vessels that supply the deep structures of the vein. So again, going back to here, if we're not able to get the blood there, then we're not going to have a very functional basal ganglia. The early signs of Binswanger would be withdrawal, depression. They become a little apathetic, so meaning that they aren't very empathetic like they might have used to been. Become a little bit more indecisive and disorganized, poor judgment, a lot of impulsivity, and less communicative. As the disease progresses, because we do know it's a degenerative disease, you'll see dysarthria a lot of times, sometimes some dysphagia, incontinence, which is bladder control or lack of bladder control. And sometimes their physical movements will mimic Parkinson's. So they have a common symptom is Parkinsonism, which is just that shuffle step and poor balance. The population at risk are those who are 50 years or older. Most women are equally affected. Most women and men, are equally affected. Those that experience hypertension, smoke, high cholesterol, and have a history of heart disease and or diabetes are at greater risk for developing BD. So if you haven't noticed yet, memory is also a big part of subcortical vascular dementia because all dementia patients usually experience some type of memory loss. However, with this one, it's a little bit more focused on the impulsivity, the behavior regulation, and a lot of times you'll see patients have outbursts and become more confused rather than forgetful. However, they will show signs of forgetfulness. Okay. So from the earliest symptom to death, 5 years is the average duration of the disease. So it's a pretty fast-moving disease. BD has an incidence of about 1.6% of adults age 50 or older. I'm going to hold this up again in case you want to read through it, and I'll have all my slides at the end available as well, or attached to this. Okay, treatment. Treatment is symptomatic because there is no cure, sadly, for Binswanger. So basically the treatment is intended only to reduce the risk factors for stroke. Many people benefit from antidepressants and like SSRIs because they're experiencing all types of different symptoms that are going to affect their mood, and anybody that's going through some type of medical distress could experience type of depressants. Antihypertensive for their blood pressure. So a lot of people with diabetes have a higher risk for this disease, and because of that high blood pressure. So taking those antihypertensive can help with the chance of stroke. A lot of people also use drugs like Tylenol to reduce the pain of atherosclerosis and thromboembolism. Excuse me, I'm sorry. Treatment is basically just to manage these symptoms, though. And what's often encouraged by PCPs are a healthy diet, sleep hygiene, regular exercise, and reducing consumption of alcohol and cutting out smoking. Usually a team for these patients include speech pathologists, OTs, PTs, PCPs, neurologists, etc. It doesn't have to include all of these professionals, but it may. However, it really depends on the need of the patient. If the patient isn't experiencing dysphagia and dysarthria, they probably wouldn't need a speech pathologist. However, if they are having those communication difficulties, then our role as a speech pathologist is to assist them in any way that we can. And that is an overview of what Binswanger disease is. Thank you for listening to me.